So, good afternoon.
Good afternoon.
So, our lesson today is going to be on injuries to bones, musculoskeletal injuries. And one of the remedies for musculoskeletal injuries is usually splinting. Splinting is usually the best method to use for somebody who is having musculoskeletal injuries. You might find a patient who is having musculoskeletal injuries, for example, fractures, you might find sprains, you might find dislocations. So today we are going to base our training on fractures. Fractures basically is where a bone is broken, a bone is broken. For example, we usually have short bones and long bones. For the upper extremities, which are the hands, we usually call them short bones. But for the legs, we usually call them long bones. So we are going to have a demonstration where we have a patient who has a broken forearm, a fracture on the hand. So I will need somebody to put on some gloves. Yes. Somebody to put on some gloves because it's an exercise that needs to somebody to put on some gloves. So as I've said, we are going to assume this patient has a fracture here. So as I approach the patient, if the fracture has happened here, I am supposed to put something called manual stabilization. So manual stabilization is applying pressure above and below where the fracture is. We are just trying to put this fracture of hand in a place where there is no movement. We are stabilizing it. Because you realize when somebody has fractures, the problem that occurs when they are being transported to hospital. People are usually in a rush to take this patient to hospital, not knowing you are causing more harm. You can imagine a fracture has happened on the arm and somebody is going to the hospital when the arm is moving up, down and out. You are causing more damage to the hand. So you might find a situation where you have taken the patient to hospital and then after you have taken the patient to hospital, they are forced to do an amputation because now the damage that has been done in the fractured area cannot be reversed. Yeah? The place that was fractured because of the movement and everything, they will have now to amputate the hand. But a simple thing as doing by this splinting helps this patient to recover. So as I approach the patient, the first thing that I will do, I'll apply pressure, manual stabilization above and below the fracture area. So I'll have Gidraf to come. So he has worn his gloves. So I'll just show him. I'm assuming that this one is by standby. So you have to put his hands where my hands are. So put your other hand here. Above and below the fracture area. So as I'm doing that, I will have my splints ready, and I also need triangular bandages. We have triangular bandages and the splints themselves. So I'll bring my splints, which are 2 for the short bone. Remember, we are trying to reduce any movement. So make sure when you want to do this splinting, make sure that the movement that you are doing is the right movement. We don't want a situation where you move the hand up and then you realize you don't have a splint, you have to go back for the splint, you take it back down again, you realize you don't have your triangular bandages, so you have to have everything and make sure you plan your move. Because the more you make many movements, the patient will be feeling pain and you'll be causing more injury to the patient. So at this point, I'll just tell Gidraf to just lift the hand a little bit so that I slide. I slide the splint down there. So as the splint is there, I will also take another splint. We do not put the splint on top of the fracture. We are assuming that this fracture is on the side. So I'll put another splint on top of the arm. Like that. So I will continue holding the arm. So if this fracture, it can be an open fracture or a closed fracture. If it's an open fracture, make sure that you control the bleeding because the bleeding might be going on. you have to control the bleeding by putting dressings and covering it up before you do the splinting. So I will take my triangular bandages. Triangular bandages usually look like this. Once they are open, they usually have a tip and everything. So I want to do this. I'm not going to lift up the arm that is broken. I'm just going to slide it. So and slide it below the arm. I don't want so many movements when we are doing the splitting. So I just slide it below, and again I will slide this to come here. So at this moment, I would also want to look at the sensory and motor functions of the hand, just to make sure that there's still sensation on the arm of the patient. So I might pinch the patient and ask them, do you feel this? Yes. So wiggle your finger like this. If they do that, you know that the patient has a sensory and motor function, to mean that the nerves are still working. There's still work that is going on in the arm. So I will tie my first one. So once I do that, I've already secured the fracture that is there. Now I'll have to do something else called a sling and swab. Again, I will use my triangular bandages. So at that level, I want you to look at this triangular bandage. This is where the tip is. So this tip usually comes to the injured arm. This corner comes here. I just place it this way. I come and place it, just again, I'm going to show that. I come and place this that way. This one, I will hold it here. So, because we don't want so many movements, I will take this hand and bring it here. After I've brought that, Gidros will come and hold this. So once I've held, the hand is held there, make sure that this tip is at this corner. What I will do, I will just take this, bring it here, and tie it on the back. This is called a sling. It's meant to hold that hand in that position. So I'll also come here at this corner. You can decide to tie or you can decide to tuck it in, either or. So for this one, you can decide, maybe you come and tie a knot, and you can come and tuck it in. So you can just leave that one. So I come again to create something called a swab. I will take again my triangular bandage. Because we want to hold this in place because of the movement. We don't want a lot of movements. So I will come here. Take this.
Swat.
Tie this one here, which we shall call our swat. So that is how you do a sling and swat. That way. So you come again and look at your sensory and motor functions. Just do this. Can you feel this? Yes. Just to make sure that you have not tied. Sometimes you might find that you tie this thing very tight. That sensation does not work. It becomes a tourniquet. So blood is not flowing in the area. So this is how you transport your patient who has had a fracture of the